This is a model that is showing the ankle, and so the ankle joint is here. Typically, the ligaments that are injured in a typical ankle sprain, we would call that a low ankle sprain, are in this area down here at the lower part of the ankle. But the injury that when we discuss a high ankle sprain, we're talking about more of the ligaments in this area, and those ligaments are very important, especially with a rotational type force. And so once again, the mechanism of a high ankle sprain versus a low ankle sprain is completely different. And so when these ligaments are injured, what can happen is with certain motions, you can actually get some gapping between those, and it leads to some motion of the ankle joint, which leads to pain. So once again, the lower ankle ligaments would be in this area, whereas the ligaments that we're discussing are more in between the two bones up here.
And again, how do you fix that ligament? I know the ligament.
Oh, so when we use the suture device to stabilize that joint, because this area we call the distal tib-fib syndesmosis is a joint itself. The tightrope is a suture device. So it's got a small button on this side, and then you drill it through the bone, pass the button through there, so you end up with a button on this side, a button on this side, and it helps to hold those two bones together while the ligaments in this area healed.
And let me see that.
The typical ankle sprain is the low ankle sprain that is a 1 to 2 week recovery and rarely needs an operation, whereas this type of injury is a different mechanism. It happens at a lower frequency, but it requires more of a force or a higher force to cause this type of injury, which takes it longer to heal. And so,
how long does the surgery take?
Oh, the surgery itself does not take very long. Probably 30 to 40 minutes totally from start to finish.
And complete recovery.
Right. Yeah. Typically, yes. So.
Right. Awesome. And I always get Dr. Matt
McKean.
M small
C. Yes, sir.
K-E-A-N.
Yes, sir.
Gotcha. And orthopedic.
Yes, I'm an orthopedic surgeon, but I have a fellowship in foot and ankle. So my specialty is foot and ankle surgery. So I do this. This awesome. Is what I do on a daily basis. So.
Anything that you wanted to say that I forgot to ask?
No, I think the biggest thing to try and relay is the idea that this is not a standard ankle sprain. I mean, that's the biggest question we get. Oh, when we see somebody who comes in the office and they've had a typical low ankle sprain, the first thing that oftentimes is asked is, do we need an operation? Or are we going to have the Tua procedure, as it's become known? And so very rarely is that ever the case. It's much a very low percentage of ankle sprains are actually of the high ankle sprain variety.
But even with a high ankle sprain, it would heal on its own.
Yes. There are varying degrees of ankle sprains, and so as long as the injury is not totally unstable, it can be treated non-surgically.
Gotcha. Thank you, man. I really appreciate it.
All right, absolutely.